Nzimande. He has a presentation he is given. Let's go there live.
It has the impact of undermining. We can start.
Good morning to the viewers at home. Good morning also to those who are listening on the radio. Good morning to everybody in South Africa. We are going to have a briefing by the Minister of Higher Education, Minister Dr. Blade Nzimande. Minister, South Africans are yours.
Thank you very much, Coordinator. Let me also greet our two Directors Generals, Dr. Philip Jwaha, Department of Science and Innovation, and Mr. Gweb Skonde of Higher Education and Training. All the DTGs who are present here today and members of the media. I hope I'm not being disrespectful if I take off little jazz. My apologies. Members of the media, ladies and gentlemen, good morning. I'm standing here today because I promised to continuously update South Africans on measures that we are taking in response to COVID-19, as well as other developments within both my departments of higher education and training, as well as science and innovation. Today I will commence my briefing on matters relating to science, technology and innovation, followed by post-school education and training matters. South Africa has indeed reached a critical stage in the battle against COVID-19, and health experts and scientists have laid out a number of scenarios that can alter the trajectory of the outbreak, depending on how society commits itself in working together with government in fighting this pandemic. Public health experts and scientists indicate that one of our best ways of fighting the pandemic is to strictly follow the protocols. On our side, we urge the following of all the health protocols: maintaining hygiene, maintaining physical distance, amongst others. The most important message that needs to go across is that we need a multidisciplinary scientific effort to defeat the virus, combining biomedical, psychosocial, statistical, and other scientific disciplines. It is clear to us that no one single scientific discipline can defeat any pandemic. It is against this background that the initiatives outlined here must be understood. Sorry. Our national system of innovation has identified potential research and innovation projects and activities, which include therapeutic trials for treatment, as well as vaccine development. As a sector, we therefore adopted the theme of science saving lives as an illustration of our commitment to use science to save lives. The choice we face in this crucial moment is between listening to science and saving lives, or ignoring science and losing lives. I wish to say that I have further mobilized the necessary and published the necessary regulations under the Disaster Management Act to assist our institutions in the higher education, science and innovation sectors to play their role in the fight against COVID-19. Let me just highlight some of the key science interventions that we are making through this department as government, indeed working with the partners that we normally collaborate with. The first thing is that through the South African Population Research Infrastructure Network, we responded to the COVID-19 emergency by developing a surveillance protocol that was implemented within a month of the first case reported in our country. What does this mean? This is ongoing research which involves telephonic interviews to screen for COVID symptoms in more than 60,000 rural households in Mpumalanga, Limpopo, and KwaZulu-Natal. This we use and will greatly help in tracking the virus and focusing on the demographic, social health, and socio-economic well-being of the entire study population. To expand to a national network and to improve its response to COVID-19 and other epidemics, this research network and demographic surveillance has now been extended to Gauteng and Western Cape provinces. Western Cape, as we know, has been our epicenter, and Gauteng is now threatening to become the new epicenter for the spread of the virus. So these studies are going to help us in understanding what is going on better so that we can respond appropriately. In the beginning of the pandemic, the Department of Science and Innovation embarked on a process to repurpose some of our laboratories to assist in testing. This means a number of laboratories that were doing other scientific work have been supported to refocus on work to support the fight against COVID-19. And one of these, for example, was the one laboratory we visited not so long ago at the Tshwane University of Technology. I am pleased that today, laboratories such as those of the Council for Scientific and Industrial Research, the Center for Proteomic and Genomic Research, the KwaZulu-Natal Research Innovation and Sequencing Platform, and the International Center for Genetic Engineering and Biotechnology, amongst others, are already conducting tests or ready to receive samples from the National Health Laboratory Services. In other words, the work that we are doing is contributing to expanding testing as well as the production of new testing kits. In this regard, the Center for Scientific and Industrial Research is already doing tests for Eskom and Goldfields, and this is directly assisting our country's state of readiness as we work towards getting our economy back on track. Now, to strengthen South Africa's active case finding survey, this is very important because it assists in tracing people who already are positive with the virus and tracing the people they might have interacted with. The Department of Science and Innovation, working together with the South African Medical and Research Council and our Technology Innovation Agency, have already issued a call for proposals to South African companies and researchers to develop what we call reagents, which are very important in the testing regime for COVID-19. also in order to facilitate locally manufactured reagents and testing kits so as to address the bottlenecks in the process of testing. We're doing this because without adequate testing, we are not going to be able to fight the virus effectively. This call that I've referred to was developed in collaboration with the National Health Laboratory Services and the South African Health Product Regulatory Authority, and has developed specific guidelines, the regulatory authority, for the registration of locally developed tests, reagents, and test kits. This is just but one unique example of multiple government departments, research councils, and funding agencies working together with academia and the private sector to accelerate local innovation. And I want to repeat this. Just as government alone cannot be able to defeat the pandemic without cooperation of all key role players and all our communities, also we won't be able to defeat the virus and find the necessary remedies unless we pull together all of our science and its disciplines to work together. In fact, evidence from other countries that are successfully fighting the COVID-19 pandemic is that they've been able to pull together your biomedical scientists, together with your social sciences, together with data modeling, as well as other scientific disciplines. Like, for instance, in our case, some of the work that we are doing involves working with the Weather Service. Some people may ask, why are we working with the Weather Service? It's because we are also using the technology of the South African Weather Bureau to test the concentration of pollen in different parts of the country. Because people with asthmatic conditions, for instance, where there is lots of pollen, they are even more vulnerable to the virus. That's just one concrete example on why a multidisciplinary approach is important, and that informs the work that we are doing as the Department of Science and Innovation. On another matter of African natural medicines, which is a matter that has been of interest to many people, we want to say that we are in the process of implementing multiple interventions, including the use of African medicines as immune modulators and anti-coronavirus therapy or therapeutics. The program has been working with the African Medicines COVID-19 research team in researching several South African herbs and formulations with documented evidence for treatment of respiratory infections, signs and symptoms. One of the herbs our team is working on is what is known as Artemisia afra. In simple Nguni language, we are doing research on umhlonyane. As the Department of Science and Innovation, we have reassigned 15 million rands from existing indigenous knowledge projects to support COVID-19 interventions and have submitted proposals for additional funding, especially for clinical studies and also for small and medium enterprise support, agro-processing, and for job creation. Our Department of Science and Innovation is also leading a research and innovation pillar of the Cannabis Industrialization Master Plan. To this extent, our focus is the development of medicinal products for COVID-19, cancers, diabetes, TB and HIV/AIDS, and neurodegenerative diseases, amongst others. Maseyibeka ngesintu, siyalenza uphenyo olunzulu ngensangu, hayi eyokuthi ibhenywe. Kodwa kunobufakazi ukuthi insangu ingasetshenziswa ukwenza imithi eminingi kabi engakwazi ukwelapha izifo. Asifuni kuma sisho kanje bese kuthiwa hayi kunzimande ushilo ukuthi hayi insangu noma singayibhema nje kusho ukuthi izokwazi ukuthi lapha izifo eziningi besingakafiki lapha besisayihlolela ekutheni kunemithi eminingi engakwazi ukuphuma ensangweni ikwazi ukuthi ibhekane ikakhulukazi nezinye izifo mhlambe ezithintene nesifuba. Olunye lophenyo lolu esilwenzayo silumnyango wethu wezobuchwepheshe. Our Indigenous Knowledge-Based Bio-Innovation Program has other 5 platforms in areas such as nutraceuticals, cosmeceuticals, technology transfer, and commercialization. What is important here is that we are working here with some of our universities like University of Venda, Wits University, UNISA, Tswana University of Technology, and emerging small and medium enterprises supported by these platforms to look into indigenous products as part of our indigenous knowledge system research. Processes are also underway at the South African Health Products Authority for establishment of dedicated structures for African medicines regulation, evaluation of African medicines clinical trials, and registration of these medicines for commercial and clinical application. I want to say today that as the Department of Science and Innovation, we place high value in conducting ethical and responsible research, development and innovation initiatives as we continue to build on our previous work with the World Health Organization African Regional Office in the development of guidelines for evaluation of traditional medicines. And we are partnering with traditional healers organizations and indigenous knowledge-based small and medium enterprises in working in this regard. And we are still committed to do more on this front. On the 8th and the 18th of May this year, our own department's African Medicines platforms held a meeting with the World Health Organization to review the role of African medicines against COVID-19 and to discuss ways in which South Africa can work with World Health Organization in ensuring that recognized research protocols are observed. Though we do not have enough resources as developed countries, but by investing in researching our own African traditional herbs that are used as medicines, it is so that these medicines or these herbs are not researched by rich people from North America and Europe, who then, when they find the usefulness of some of these, they then register these herbs as if they were European or North American herbs, and being then sold back to us here in the continent of Africa, when often at exorbitant prices, when these were our own indigenous herbs. We are even committed in indigenous knowledge to the extent that we are planning the establishment of an indigenous knowledge-based bio-innovation institute, which will be a precursor to Africa's first plant-based pharmaceutical industry. I also would like to take this opportunity to report on and also officially release a report, which will be on our website, on the latest business innovation survey that we undertook last year, 2019, covering the period 2014 to 2016, which showed that more than 2/3, 69.9%, of South African businesses are innovation active. I'm today formally releasing this report at a time also when businesses are being forced to become more innovative in order to survive the current unusual circumstances created by COVID-19. We therefore need to ensure people's safety whilst businesses are operational. I must say that out of this report, I've come across some amazing innovations by South African businesses. The reason why I've appointed an industrial envoy, amongst other things, is so that we can strengthen the relationship between government and the private sector in driving more innovation in South Africa, including increased investment by both the public and the private sectors in research and development. I urge all role players to read this report on the Business Innovation Survey. At the same time, we have got extensive international cooperation in the area of science, and specifically also building on that in order to be able to take forward the role of science in fighting the current coronavirus, COVID-19. We continue as the Department of Science and Innovation to work to foster international partnerships to bolster South Africa and African ability to respond to COVID-19. One of our entities, the National Research Foundation, together with its partners in Canada, Sweden, and the United Kingdom, has launched the Africa Rapid Grant Fund to support research and science capacity building in African countries to fight COVID-19. This is very important because it puts into practice the commitment made by our President Cyril Ramaphosa at the recent Coronavirus Global Response International Pledging event for South Africa to invest in such international partnerships. For instance, our department, together with the National Research Foundation, have been successful in leveraging close to 75 million rands in funding from international partners from Canada, Sweden, and the UK to supplement our 15 million rands. This will mean that this fund has now a total budget of approximately 90 million rand to fund COVID-19 initiatives in South Africa and 16 other African countries. The activities to be funded include COVID-19 research as well as capacity building for science communication, including support to journalists and science advice to governments in Africa. It is envisaged that the project supported by the fund will start no later than August 2020 in order to ensure a rapid response. Let me now move on to deal with progress, reporting on progress and challenges in the post-school education and training initiatives that we have been embarking upon. Primarily to deal with COVID-19, but also beyond just COVID-19, it will be progress report on some important initiatives we have embarked upon in transforming this sector. Let me start with the issue of the phased return of students to our universities and colleges and community education, including community education and training colleges. On universities, I want to say that under level 3, which we are at now, at level 3, we only allowed a maximum of 33% of the student population to return to campuses, delivery sites, and residencies on condition that they can be safely accommodated and supported in line with the health and safety protocols as directed by the Department of Higher Education and Training. To remind ourselves, we said this 33% of the returning cohort of students will include the following groups of students. Students in the final year of their programs who are on a path to graduating in 2020. Final year students who require access to laboratories, technical equipment, data, connectivity, and access to residence and private accommodation. Students in all years of study that require clinical training in their programs. And postgraduate students who require laboratory equipment and other technical equipment to undertake their studies. I have already published on the 8th of June a gazette which provides clear directions on the criteria of who is going back to campus. And I would really like to urge parents and the students to observe these directives. It's only those students who fall into the categories of 1/3 and who are being called back by the universities and colleges, guided by ourselves. Students who are not supposed to go back, we urge them not to attempt to go back to campuses, because by doing so, they are undermining our management and the fight against COVID-19, and in the process, their behavior can directly lead to infections and to deaths. And I hope everyone now is sane enough and absolutely clear that as we are speaking now, many of us watching and listening at home are beginning to know someone who has died as a result of COVID-19. So it is serious. It is not a government that is inconsiderate, but it is a government that is concerned about saving lives, as we say in our own theme, whilst at the same time attempting to finish the academic year. As we speak, all public universities have provided plans and are managing the permits for identified students to return. Private higher education institutions have also provided plans in this regard. All our universities have provided the dates for the planned return of students, and we urge parents to follow these closely, in line with their risk-adjusted strategy linked to the localities. All universities continue to support their other students through remote multimodal teaching, learning, and assessment strategies and plans. My department is closely monitoring the return to campuses and the implementation of the teaching and learning plans. Finally, as students requiring clinical training will remember, have already returned to their campuses over the period between 11th of May to 20th of June. The planned and staggered return of the remaining 33% of students to campuses is taking place over a period from the 17th of June, when the first students arrived at some universities, until late August, by which time the full 33% will have been reintegrated into campuses across the country. To date, 20 universities have welcomed students back onto their campuses and residences. As we all know, universities never open at the same time, never reopen at the same time. They all do this according to their own plans and character, and this is what they are doing now. They are not going to be taking the first 33% at the same time. It will be staggered according to the plans and state of readiness of our institutions. For example, the following institutions have planned to reintegrate their students, the first 1/3, by end of August 20. Sfako Makgato University from the 13th of July, University of Fort Hare from the 13th of July, Mangosuthu University of Technology from the 17th of July, Walter Sisulu University from the 1st of August, Tswana University of Technology from the 3rd of August, and the University of the Free State from the 31st of August. We are working with universities in South Africa and Higher Health, our higher education health organization, to give support to all of our institutions. In terms of the planned return to campus and the reworking of the 2020 academic year calendar, the 2020 academic year, we may as well say now, will only be completed in the early part of 2021. This will mean a later start to next year's, that is 2021 academic year for many students. And this will require also a readjustment of the 2021 academic calendar. This means we really have a lot of work and challenges on our hands. And I would like to use once more this period to urge all the stakeholders to work together to ensure that we succeed. Because any mistake that we could have avoided can be very costly at a time when we need every hour to try and rescue teaching and learning by whatever means. by those who have gone back and by those who are still at home. I must also indicate that we have been discussing with the Department of Basic Education to determine their plans on the coming to an end of the 2020 school year. It is likely that the intake of first-year university students in 2021 will be later than usual. This will require a change in the normal academic year to ensure that the 2021 academic year finishes within the 2021 calendar year. Amongst other things, again, it's my plea, let's not turn into a fashion this idea of making our institutions not to have classes. It's very important that we must protect teaching and learning and minimize, if not eliminate under these conditions, any actions that may jeopardize attempts to finish the academic year. But as you can see now, already because of the challenges we are facing in 2020, already we are going to have pressure for the 2021 academic year. So everyone, parents, students, other stakeholders must realize that unless we cooperate, unless we commit not to waste teaching and learning time, the future of many of our students, thousands of them, will be at stake. I also plan to publish guidelines in the Government Gazette soon to guide institutions, private accommodation providers, NSFAS and fee-paying students on issues linked to tuition and accommodation fees for the 2020 academic year, given that it will be extended, as I have said, and there have been substantial changes already due to the COVID-19 disaster. I will inform the public of the details on an ongoing basis and in due course. All other students, as I have said, remain supported through remote multimodal learning and teaching, which is a mix of online as well as physical delivery and other ways of accessing materials. On TVET colleges, for the technical and vocational training colleges, students have returned as per our announcement last time. For example, the N6 and N3 students were back on the 10th of June, N5 and N2 students on the 15th of June, N4 and N1 students as from the 22nd of June, and NATED semester business studies students returned as follows: N6 on the 25th of June, N5 on the 29th of June, N4 on the 6th of July. We are now awaiting the return of the NCV, National Certificate Vocational students, as follows: Level 4 on the 13th of July, Level 3 on the 20th of July, and Level 2 on the 27th of July. Like the universities, TVET is using higher health and safety protocols on the phased return of students. Again, we must say we are lucky to have had Higher Health, which actually is an organization that works very closely in our sector to assist us to manage COVID-19 at this point in time as our most important challenge. On community education and training colleges, under Level 3 lockdown, the colleges, the community education and training colleges, your former adult basic and education training centers, opened on the 23rd of June, and the expected return rate was 133,000 students who are enrolled for the General Education and Training Certificate, ABET, Senior Certificate, and Occupational Programs. An indication that has been given by college management is that unfortunately the return rate is low, mainly due to anxieties or fear of exposure to COVID-19. In addition, the return rate is affected by the closure of 312 community learning centers out of the 1,810 community learning centers due to the fact that the hosting schools for those centers were not complying with the regulations for operation under COVID-19. We are expecting colleges to submit reports on their assessment and evaluation of the state of colleges since the resumption of the academic programs on the 23rd of June 2020. The reports in which the actual numbers, that is the student return rate, are reflected are to be submitted no later than the 10th of July 2020. A question may as well be asked, because we don't want to be a government that hides information. Do we have infections at colleges? Yes. Community colleges have experienced some infections, in particular in the Northwest Free State, Western Cape and Gauteng. They are the worst hit so far by the pandemic. Are we confident to allow students back at our institutions? The answer partly to this is that given the challenges confronting most of the hosting schools, the community education and training colleges cannot at the moment cope with the return of the full complement of students who were registered at the point of the declaration of lockdown. Unfortunately, our community colleges are in a far riskier situation than universities and TVET colleges. Not that those are immune either, not saying that at all, but they have got additional challenges. It is our considered view, therefore, that for the 2020 academic year, serious considerations will have to be made that the return of the students be limited to general education and training certificate, ABET qualification, senior certificate, occupational programs, and adult education and training sub-level 3 students. This will enable community learning centers to comply with regulations, especially the issue of physical distancing and the provision of adequate personal protective equipment for staff and students. Now, you might say I left out the issue of safety on universities and TVET colleges. It's because I now want to address the work that is being done very briefly by Higher Health in the entire sector. It's imperative that as the Department of Higher Education and Training, led by Higher Health in this instance, in collaboration with the Department of Health and other stakeholders, we continue with programs and innovative measures as part of our ongoing effort.
AU Chairperson President Cyril Ramaphosa is taking part in his capacity as AU Chair in an ILO meeting. Let's go live to that now.
Existence untouched.
As well as the Umgungundlovu TVET College. I must say I was highly impressed by the state of readiness of the college and the university at the time. The TVET College had already welcomed some students, and they were in the process of welcoming others in line with the TVET College phased approach. Cleaning and disinfection, including disinfection post a COVID-19 positive case, is confirmed on most campuses, guided by protocols also developed by Higher Health, which I have already released. These protocols guidelines have helped our sector towards a smooth phased approach of opening to prevent infections, build systems for screening, testing, quarantining, and linkage to medical care, and address mental health problems and substance abuse exacerbated by this pandemic. We regularly update and align these guidelines according to the National Institute of Communicable Diseases, the World Health Organization, and the instructions from our own health department. The number of infections across South Africa, and especially in certain districts and metros, has climbed quickly in the last couple of weeks. The gradual reopening of the post-school education and training institutions takes place within this context. And it's clear, let's not hide it, that we will have infections in our institutions. What is important is how do we deal with those and how do we manage those according to the health protocols and guidelines. That is why, amongst other things, Higher Health has also developed a purpose-built daily digital screening and monitoring tool that enables all post-school and education and training students and staff to check for COVID-19 risks and symptoms every day. For those who cannot screen through health check, screening stations have been developed at every campus level close to entrances using paperless digital platform towards assisting in screening of those who are needy. I must also report that this self-screening tool developed by Higher Health, which was launched about 20 days ago, has already recorded over 600,000 screenings done across the post-school education and training system, with students and staff using the health check either through WhatsApp or the website. Now, what is positive about this is that both staff and students are using this facility by Higher Health. We welcome that and we encourage them to do so. From this data thus far, what is emerging is that the overwhelming majority of those who have used this screening are in the low risk category, about 95%. The 5% that fell within the moderate to high risk were immediately placed in self-isolation, further assisting towards limiting the spread of the infection and helping towards the phased smooth opening of our sector. Age-wise, about 80% fall into the largest age bracket, those who are using this, 18 to 40 years, followed by a fifth that are between 40 and 65 years. Both private higher education and skills-based learning centers have been equally prioritized in line with trainings and protocols for their planning towards smooth opening of their campuses. What we want to say is that we're working to closely monitor the situation in our sector, the extent of the spread of the virus and the activities that are being taken by our institutions. And we'll do our best to try and regularly update the country and the nation on the situation as it develops in our post-school education and training sector. On the issue of zero rating of education websites and data bundles, I had already covered these matters quite extensively last time. I just want to quickly report that everyone in the post-school education and training sector, from universities, TVET, and community colleges to skills development programs, are embarking on modes of education delivery that embrace the principle of open learning. We've started with some initiatives like distribution of laptops and data to students, the development of high-quality connectivity for all universities and TVET colleges in collaboration with the Department of Science and Innovation and other initiatives. Our Center for Scientific and Industrial Research is continuing and has already briefed me on its work on geospatial mapping to try and assist with the location of university and TVET college student homes in relation to areas of connectivity in our country. In other words, what they are doing is to try and say, where are our students, their homes, where is connectivity in relation to those homes? It's a very extensive exercise. It's not easy, but the CSIR has started doing some of this work, which is very important. We are, however, encouraging all of our institutions in common localities and working in the same areas to work with each other, with public and private enterprises, with social structures, with communities they serve, and with local and district and provincial government to create articulated, seamless, responsive education and development opportunities. We have to think about sharing learning and teaching materials increasingly and support the open educational resource movement. Also, we are urging our institutions to share infrastructure, expertise, and systems. For example, If there are University of Pretoria students who are at home but are not very far from a UNISA campus or from a campus of the Vaal University of Technology, why not they be allowed to access that if that will help them to be able to keep in touch with learning and teaching? We are encouraging that. We also want to thank the Department of Communications and Digital Technologies and the mobile network operators that have already zero-rated our websites. We stand currently on 96%, about 592 of educational sites that are zero-rated. And the Department of Higher Education and Training and the Department of Communications and Digital Technologies are working effortlessly to get all sites that adhere to the criteria as published in our government gazette to be zero-rated. Most universities have already negotiated free data bundles with the mobile operators to pay for additional content that is not covered through the zero rating. We have negotiated with all mobile network operators very favorable rates for our NSFAS and Funza Lushaka students for 10 gigabytes daytime and 20 gigabytes nighttime data for 3 months. I have already been receiving very positive response from many of our institutions on the take-up and application of these data bundles. However, I urge the mobile operators to please fast-track these bundles to students. I must also say that I remain unhappy about some of the reports that I am getting that some of our students are using the data bundles for private use, such as for downloading movies and even disturbing undesirable content. I just want to emphasize once more, this data must be used for dedicated online education platforms, for teaching and learning as approved by our institutions. Everyone should know the more you spend your data bundles on movies and other undesirable context, the further away from you wearing your graduation gown. It's as simple as that. It's as simple as that. We've also made free digital content available to specifically our TVET college students through our DHET, Higher Education and Training website, the National Open Learning System of the department, institutional websites and other sites where students can find digital materials to assist them in their learning and preparation for the exams. On gadgets, the laptops in the main, I announced on the 30th of April that NSFAS funded students will be provided with these devices. What I want to say is that some universities have gone a long way. In fact, we estimate that over 65% of our universities currently are in different stages, commenced, and some have even completed, of the procurement processes for these devices. The rest of the devices for the TVET colleges and some of our universities that will be further procured centrally, we have already now, through NSFAS, advertised the tender for the provision of these digital devices. The tender, because of government processes that have got to be followed, was advertised on the 26th of June, with the closing date being the 13th of July. It is anticipated that tender award and contracting will be completed by 15th August 2020. I don't want to go into the details of matters of tenders because ministers are often not involved in the details and management of these. But I need to say this, that in order to stimulate growth and empower our local economy, this tender for gadgets provides only for BBBE Level 1 and Level 2 contributors who are eligible to bid for these. In addition, the bidders must subcontract at least 30% of the contract to a small medium enterprise which is at least 51% black-owned. On this, we are not compromising. COVID-19, much as it is a cloud, but its brighter side must also be to contribute to changing our economy quite drastically and significantly, and expand the participation of South Africans who have been excluded thus far. In addition to the tender requirements and to support local manufacturing and production, all laptop bags that will carry these laptops must be 100% locally manufactured and produced. There is no need to import a laptop bag, which is something that we can produce in South Africa. A memorandum of agreement between all academic institutions and NSFAS will be signed for concurrence on terms and conditions for the transfer of funds for the procurement process. Subsequent to the signing of the memorandum of agreement, a list of all NSFAS-funded students that require digital devices should be provided by the academic institution to NSFAS for verification and vetting. So there is progress. Those who have not received, be patient. You will receive your gadgets. In the meantime, make use of the other modes of accessing learning as provided by our institutions. I also wish to take this opportunity and say I'm pleased to announce that I have appointed a Ministerial Committee of Inquiry into the National Student Financial Aid Scheme to conduct an independent investigation into the business processes, systems, and capacity of NSFAS. The committee is set to make recommendations for a future model of administering student financial aid. Professor Eunice Balim, the former Vice-Chancellor of Solplaatje University in Kimberley, who has also been Professor of Civil Engineering at Wits University, has been appointed to chair this inquiry. The other members of the committee are Mr. Kanya Matiso, Professor Pamela Dube, Ms. Nomzamo Mazia, and Mr. Baxolile Mabinya. The committee is expected to complete its work within 6 months. The detailed terms of reference for the inquiry are included in Government Gazette number 43345, which is dated 21 May 2020. This can also be accessed in the website or from the website of the Department of Higher Education and Training. I would also like to take this opportunity to correct any confusion about the role of the Committee of Inquiry in relation to NSFAS administration. The NSFAS administration period comes to an end in August 2020, and the administrator, Dr. Randall Carlson, continues to be in office until that time. The inquiry is independent of NSFAS and has no role in terms of its current administration. In other words, this task team is not to administer NSFAS. I want to clear that confusion. It is to do a particular investigation and report back to me in 6 months. I thank the members of this important inquiry team for their willingness to serve and to undertake this important work. The other task team report that I would like to officially release and announce is the Ministerial Task Team report on the recruitment, retention, and progression of Black South African academics. Just by way of brief and quick background, in 2015 I convened the Second Higher Education Summit on Transformation. Amongst the things highlighted at this summit was that the sector should build on the nationally coordinated program to enable accelerated capacity development, greater representation, and improved retention of blacks and women in the academic workforce, professoriate, and university management and governance structures, especially South African black and women academics. I specifically appointed the Ministerial Task Team in this regard, which was led by Professor David Mosoma, to investigate this issue deeply and to identify the blockages underpinning the slow pace of academic staff transformation at universities and to make recommendations on how these can be addressed. I'm pleased to announce that the task team has concluded its work and has submitted its report, and I'm releasing this report today publicly, and it is again available on the website of our Department of Higher Education and Training. Without going into detail, I urge everyone who's got an interest, any South African, especially in our sector, in our university sector, to read this report and seek to engage with it, because I am inviting everyone to engage and comment on this report and to also send comments to us. This ministerial task team identified a number of issues or blockages to the identification, recruitment, retention of especially black South African academics and women in our universities. And they broadly grouped this into 5 categories. I'm not going to go into detail. Firstly, they identified that there are impediments in the postgraduate pipeline. In other words, the South African postgraduate pipeline is woefully inadequate to support the aspirations of a developing and transformed South Africa, especially in terms of participation and success by South African black and female students in the postgraduate pipeline. The second broad area is that staff participation and progression, there are huge impediments here. The underrepresentation is more pronounced at senior levels and is more pronounced at specific universities, typically the historically advantaged universities, and especially at the previously Afrikaans institutions. Huge shortage of black and women academics. It appears that some universities may be seeking to address staff transformation imperatives through the recruitment of black academics from the rest of the continent. Our system must have people from other parts of the world, but we can't use the recruitment of academics from the rest of the African continent as a substitute or as a means to prevent the increased participation by black South Africans as academics. The other area that they've identified as broadly an impediment is institutional cultures that work in overtly and covertly racist and sexist ways to maintain the postgraduate student profile or the staffing status quo in certain spaces. In other words, racism and patriarchy are further issues that need to be confronted, that are an impediment to the production of more black and women academics in South African universities. The fourth broad category this task team identifies is the fact that there is policy disjuncture or inadequate policy strategy in addressing some of these measures. Lastly, also they identify resource impediments that continue to impact on the pace at which the postgraduate pipeline and the staffing pipeline can be transformed. You know, my 2 DGs, what I'm happy now about this is that this problem sits with both your departments. Because the universities are directly falling under the Department of Higher Education and Training, but funding for postgraduates falls under the Department of Science and Innovation. So I have a lovely headache. My lovely headache is to whip both DGs to say, you have absolutely no excuse. Unlike before, you are now under one minister. You are part of one family. Let's address this problem once and for all. It is my intention that after a period of 2 months of public comment, I will then be receiving recommendations and then compile them and present a report with recommendations for adoption by Cabinet. The last issue I want to talk about, I'm raising these issues, by the way, because also we don't want to be a gloomy South Africa that since we are in the midst of COVID-19, other important work is not happening. We are even given this, like the scientific work that we are doing, as well as this other important work in the transformation of our sector is continuing. The last matter I would like to report on is on the Ministerial task team to advise the Minister on matters of sexual harassment and gender-based violence and harm, especially in our universities, but generally in the post-school education and training sector. In 2019, Minister Pandor was Minister of Higher Education and Training then, prior to the elections. Last year, appointed a ministerial task team to look into this question of gender-based violence in post-school education and training sector. This task team was led by Professor Smongile Mutwa, who is the Vice-Chancellor of Nelson Mandela University. The task team commenced its work in July 2019, at the time when I was minister, and has concluded its work. Made recommendations on what is to be done. Now, those recommendations and the framework has now been adopted by Cabinet, and I will be gazetting that shortly. And I'm calling upon all our post-school education and training institutions to use that framework to develop their own measures to combat the scourge of gender-based violence. This is historic and very important. We are amongst the first, if not the first, sector in government to actually adopt our own framework in the post-school education and training sector to deal with gender-based violence. We hope other sectors will follow suit if we are to deal with this. I'm sorry, I made a mistake. That was the last but one issue, the very last one. Following a request from the Portfolio Committee on Higher Education, Science and Innovation, I have decided to ask the Council for Higher Education to undertake research on the salaries of vice-chancellors and senior executives in our public universities. This research that I've asked the Council for Higher Education to undertake will provide me with advice will assess evidence and provide advice on the annual data on the remuneration of vice-chancellors and senior executive managers and annual salary increase, at least from 2005, which is the period when we had the mergers of our institutions. Amongst others, this research must focus on the comparisons of salaries of vice-chancellors and senior executive managers to those of academics and the rest of non-academic staff and workers for the period covering 2005. Portfolio Committee was concerned, a concern which I share, that actually there is often no correlation between the size and nature of the institution and the salaries of vice-chancellors, amongst other things. And that also there is concern that the gap between the salaries of vice-chancellors and ordinary workers on the ground is just too huge. So this matter at last, we will now be able to get expert research and advice, and the CHE we have agreed that this study will run for the next 11 months with the following deliverables: that they will complete their findings, their research by the 31st of March next year, and then advise me accordingly and the sector on what is to be done about these particular matters. Thank you very much. Siyabonga kubo bonke ababukayo nasemakhaya nabalalele ukuthi yini izinto esizenzayo ukuthi ezikhungweni zemfundo ephakeme kanye nasemkhakheni wezokuphenya nobuchwepheshe iziphi izinto esizenzayo ukuzama ukuxazulula inkinga eziningi ezibhekene nezwe lakithi kulesikhathi sanamhlanje. Siyabonga.
Ngiyabonga mphathisa. Sesiyongena esigabeni sethu sesibili. We are now going to get into our second part of the program, where we will be taking questions from the journalist and also through WhatsApps and calls. Joining me is Ignatius Masilela, who will take our WhatsApp messages, and also Ishmael Silimale, who will take phone calls. My name is Ishmael, and I'll proceed with the program going forward. Let me also remind you that we are joined by the two DGs, who will also be assisting the minister in taking the questions going forward. Thank you very much. Let me start with Ignatius. Do we have any questions on WhatsApp?
Thank you, Mr. Mnisi. I have one question from Angelo Coppola from CGNTN. What is the status of the alleged Madagascar remedy? Has it been tested in SA? And what was the outcome? That's the only question.
Thank you very much. Braish?
Thanks, Chairperson. We don't have questions on the line. Thank you.
Thank you very much. For now, we have only one question on the Madagascar question. Let me welcome the Director General of the Department of Science and Innovation to take the question. DG, if you can come forward, please. Oh, thank you.
Thanks very much, Ishmael. The study is conducted in partnership with the Council for Scientific and Industrial Research in Pretoria. So our scientists are working with the Madagascan researchers to try and look for the active ingredients that the minister referred to in the plants, to look at whether this plant is able to have effect on the immunomodulation of the virus. So this is work in progress. These things take some time, but we are working with our Madagascan researchers in order to make sure that proper protocols are being followed and the effective ingredients, once found, the clinical research is done and the data is profiled to be given to the Health and Products Regulatory Authority. Thanks very much.
Thank you very much, DG. Tim, do we have any questions either from WhatsApp or from the calls?
On the calls, still no questions, Chairperson. Thank you.
Thank you. Ignatius?
None so far.
No questions.
Yes.
Can we declare that this brings the second session of our media briefing to an end? With only one question. I think the statement was elaborative, very clear. We will share the statement with the members of the media. We have already done so, and will continue to do so through other platforms, if there are no further questions. Okay, it seems as if there is a question coming. Okay, there is one question, Minister. Also, it is from Nosipo, who is asking if she would like to know if the minister will also address the issue of unpaid stipends to learners for the past 3 months. I think this issue we have been reporting on for the past 3 media briefings that we've been having. Would like to get more on it, but I think I'll also give the minister an opportunity to raise a few comments on it. However, if colleagues can assist us by becoming specific where such problem exists, so that we can be able to deal with that. Thank you very much. Do we have any other question?
Yes, Mr. Minister.
Yes, yes,
I have a question
Nishas?
from WhatsApp.
Yeah.
I have Betty from Channel TV. She says, a group of traditional healers protested outside vets last week against the vaccine trials. Is this herbal research in response to their concerns, or is it in consultation with them? Thank you, Mr. Minister.
Thank you very much. Are there any other further questions, colleagues? Only these two? We are asking that members of the media send questions to the team. I see that some are sending it to me, and there are also students who are sending questions. If we can take questions from members of the media and the students that are sending me messages now, will directly respond to their queries, their personal queries that they have, as we normally do. Thank you very much. The two questions, Minister, the issue of stipends and the protest. I don't know if the DG is aware of that as well.
Ngcono masikhipha lento masikhuluma weishmael ngoba inkinga khona omunye obephawula la ngihluphe kabi umoya wami ngiza la emotweni ukuthi hey thina nje bosopolitiki si-vulnerable ngendlela eyisimanga ngoba kwala manje kufanele siyokhuluma nabe indaba sikhipha ama-mask bese kube ngathi siyisibonelo esibi sibe sithi kubantu abakhipha ama-mask. Inkinga lena kungayazi ukuthi soyenze njani ngoba kufuna sisebenzile sizama ukulwa nalento kodwa futhi ekusebenzeni kwethu kubuye kube ngathi siphula umthetho. Asiphula umthetho njengoba ngasho ngenzela udadewethu abona indebe zami zomlomo nabaningi abafana naye abangezwe. Well, I think on the issue of the DG has already answered the question on partly on traditional healers, indigenous knowledge and all that. We have been working, we are not doing this work in response to this recent protest. We have been doing work at this department for years now on indigenous knowledge system, and we've got structured relations with organizations that represent traditional healers. To do research, work with them on the many herbs that they also use to further from a scientific point of view find out if these they work. Mhlambe kuzofuna ngibuye ngiyichaze lento ukuthi lento yokuthi sisebenza nezinyanga nabanye abalaphi bakithi bomdabu akuyona into eyenzeka ngoba naku kube khona abantu bakithi abayinyanga abaye baya enyuvesi yakithi lapha eVits bayoteleka ukuthi balwela ukuthi abanakwa. Umsebenzi besivele siwenza nabo lo kusukela kudalo silo mnyango sisayimisele futhi nokuqhubeka sisebenze nabo sibambisane nabo ngoba sikholwa ukuthi kuningi okukhona la emakhanjini okuwusizo kodwa ke futhi okudinga ukuthi ke sicubungule kahle ngobuchwepheshe ukuthi ngempela yini le ewusizo kungako njengoba sisho nje ukuthi ke nomhlonyana nawo siyawubheka nezinye izinto siyazama ngako konke okusemandleni njengoba sisho nje ukuthi sinobudlelwane nenhlangano eziningi ezimele abalaphi bendabuko noma inyanga zakithi ekusebenzeni kulolu daba. Ngicabanga ukuthi kuyawuphendula umbuzo lokho. It does answer the question. On unpaid stipends, it's very difficult to answer this question generally. What we have said, firstly, let me clear this. that all NSFAS and allowances continue to be paid till now. Where there are NSFAS allowances that are not being paid, let's be told exactly, through communication that we have, our call center, as well as, by the way, NSFAS call center itself, who is not being paid where. You can send that information to us so that we exactly follow where the problem is. Because we don't want to talk in general terms. In some instances, we've found in following up that there are genuine concerns and these problems are addressed. But in other instances, we also have people who are chancing. Like, for instance, in this issue of the 350 rands announced by the president, you find there are people who are already on other grants, including NSFAS, by the way, who are taking a chance to apply for this amount of money. That's why we don't want to deal with this thing in general. Give us specific information. And Ishmael, I'm sure now we are going to be even to give further information on where people should inquire or report the problems that they have. We commit that as soon as we receive a problem of that nature, we will actually resolve it. Esikushoyo ukuthi uma unenkinga ngo-NSFAS, ngiyayiphinda lento njalo, ngihlale ngixekwa ngalento bo-DG ukuthi ngilongigcizelele. Enye intsha ayithandi lento ukuthi ngiyabaceba kubazali ukuthi u-NSFAS bayawuthola. Cha, bayawuthola. Angiceki kubona, ngikhuluma iqiniso. Mangabe kukhona abawufihlayo kubazali ukuthi kunozukanye abawutholayo, akuyona inkinga kaNzimande leyo. Inkinga yabo, mina ngizoyisho lento ukuthi lo zukanyana osizayo kakhulu kaNSFAS uyatholakala. Uma ngabe kukhona abantu abakuNSFAS okufanele ngabe kunoxhasa abalitholayo kodwa luyelwama njengamanje ngendlela abangayiboni ukuthi kwenzeke kanjani lokho, sicela ukuthi bazisho, bashaye ingcingo, bathumele nalabo ezukufanele bathumele khona eminyangweni wami. U-Ishmael uzozisho futhi akhumbuza abantu lezi zinto noma khona kwa-NSFAS ukuthi
Higher Education Minister Dr. Blade Nzimande speaking then a range of issues, speaking about the investigation into NSFAS, an investigation into identification, recruitment and retention of black academics, which found that the postgraduate pipeline is very difficult, in particular for black female South African academics, speaking about how most people should try and access that report and see why higher education institutions are still battling to retain black South African academics.
Hambe bo-applyela lo 350 rand we-COVID yabantu bakithi abangasebenzi. Abanye babuthola ukuthi bayawathola amanye ama-grants kwenye indawo kodwa futhi sebefuna ukuthi bathole nalolo lunye uxhaso bebe bazi kahle ukuthi umuntu oselithola uxhaso kwahulumeni akusafanele abuye alithole kwenye indawo. Nabaka-NSFAS siyezwa abanye babo bebetholakala. U-applyela u-350 rand kodwa uthola u-NSFAS. Siyazi ukuthi inhlupheko ibhokile ezweni lakithi kodwa umona ke uphele nawo. Ukuze wonke umuntu ongatholi uma kufanele athole imali yakhe ingadliwa umunye umuntu. Ingakho ke senza isiqiniseko sokuthi sicela abantu basitshele ukuthi bawobani, bashayele endaweni ezifanele. Uma lifika udaba kuthina sizolandela noma kanjani. Ngiyabonga.
Thank you very much, Minister. As per your request, let me remind our students and the parents that the details for NSFAS, where they must send their inquiries, is as follows. It's 080006732. Let me repeat again, 080006732, or they must email collections@nsfas.org.za. They can also send their emails to enquiries@nsfas.org.za. These are the contact details for NSFAS. And for those who want to contact the Department of Higher Education, we have given the details before. And just to remind all of us that you can as well send an email to Mnisi, to ishmael.mnisi@dst.gov.za. If you want to send those details to the Office of the Minister, we will then take it from there and consolidate and deal and send it to other relevant structures that would want for them to respond to the inquiries, particularly on the issues of stipends. Thank you very much. Tim, may I check once more if we have other questions? Yes, Ishmael? Ignatius?
Thank you, Mr. Mnisi. I have another question from Angelo from CGTN. The question is the minister and his counterpart in lower education considering cancelling this academic year? That's a question. Thank you, Mr.
Cancelling the academic year?
Yes.
Okay. Ishmael, do you have any further question on the line?
No questions on the line, Chair. Thank you.
Thank you very much. Minister? This is the last question we are taking, ladies and gentlemen.
The answer to this question is that no, we are not yet considering cancelling the academic or the school year. That is why in our case we've got our rallying cry of hashtag save the academic year, hashtag save lives. We have not reached that stage as yet. We hope we do not. But it's very difficult to tell at the end of the day, depending on the trajectory, or as the scientific word goes, the epidemiology of the disease. We are trying all we can. As you know, my colleague Minister Motshekga is also working very hard to try and save the school year, and having prioritized, for that matter, your grade 12s, now followed by grade 11s. We ourselves, also in the first 1/3 of the students that we are calling back, we are prioritizing final year students and those who are closer to graduation, because we are trying all we can. So we haven't taken a decision to cancel the academic year, as of now. How things may pan out in future, it's very difficult to tell. Ngamanye amazwi asinayo inhlelo zokuthi unyaka lo wokufunda sivele sithi siyayeka, siyakhansela yonke into sekoqalwa phansi ngonyaka ozayo. Cha, asikakasithathe isinqumo esinjalo sohulumeni. Sisingako sisazama ngawo wonke amandla nje. Thina kulomnyango wethu sithi ke into esisebenzela phezulu kwayo sithi asindise impilo, kodwa futhi sizama ukuthi unyaka wokufunda uqedelwe. Ingako senza konke sisemandleni nozakwethu umama enje Motshekga naye wenza konke okusemandleni, ikakhulukazi ukuthi sibekele phambili labantwana bese bevela beqede esikoleni, njengoba naye bekelele phambili ugrade 12 landela ugrade 11 manje. Ngakulwethu uhlangothi sibhekelele kakhulu laba sithe ababuyele manje ekhungweni zokufunda, yilaba sebeqeda abenza unyaka wokugcina, ngoba sizama kona njalo ukuthi unyaka ungonakala. Basazolandelwa abanye ngokuya ngokuthi isimo siyethemba ngokuthi siye ngokuba ngcono. kodwa kugcineni akekho ongasho ngokusiqiniseka ukuthi kogcina kwenzakaleni ngoba lo mthakathi walesifo asimazi ukuthi kothi kuphela unyaka kobe kunjani sinethemba ukuthi kuzoba ngcono nokuba ngcono ke njengoba sihlale sihlo ngakolunye uhlangothi futhi kulele ezandleni zethu ngoba uma senza izinto ngendlela okuthiwa sizenze ngayo sizokwazi ukuthi isimo sibe ngcono sikwazi ukuthi izingane zethu zingalahlekelwa ithuba lokufunda kodwa asikakasho ukuthi siyayiyeka nje indaba yokuthi kuyafundwa kulonyaka sisazama ngako konke okusemandleni siyabonga
Thank you very much, Minister. As we close, let me also share the call center number of the Department of Higher Education and Training. The number is 0800-872222, and you can also send an email to callcenter@dhet.gov.za. With those few words, I would like to thank the Minister, the two DGs, colleagues from the department, ladies and gentlemen of the media, for the time that you have given us. The statement is now available on both the Department of Higher Education and Training as well as the Department of Science and Innovation, and we have also sent it to our media list. Thank you very much for your time.